I'm Dr. Dielwart. Today I'm going to walk you through the steps of performing an ACL reconstruction surgery. The first step of any ACL reconstruction surgery is actually to confirm the diagnosis. Once the anesthesiologist gets you off to sleep, we do an examination on the table to ensure that the ACL is actually deficient. Once I'm happy with that, we then go directly towards grabbing a hamstring from the back of the knee. We make a small incision at the front of the knee and we actually isolate the semitendinosus tendon. Then we use this fancy thing called the tendon stripper, wrap it around that tendon and pass it up the back of the knee like so. And the graft actually gets delivered right to the front of the knee. For the sake of this exercise, we'll use the shoelace here. And we take this to the back table and then we go ahead and we make our graft. So we use implants called tight ropes, which actually has a little metal button and then this rope here that's gonna be our anchoring point for our new ACL. So we take our graft that we just got from the knee and we pass it through these ropes and fold it back upon itself. We then use a variety of sutures to affix these onto these tight ropes. So now we'll pass these two in. So what was once one strand has now become 4 separate strands. And we're now going to secure these together using another stitch. All right, that's going to be our new ACL. So now we'll put it on some tension to allow some early stretch to come out of it. And we also size this graft at this time to see what size it is. Now that we have our new graft that's been prepared on the back table, we actually set that aside and we now start to make the knee ready for the acceptance of the new ACL. So the first thing we do is make 2 small incisions at the front of the knee so the knee can accept both the camera and the instruments to pass the new ACL. We're then going to drill some pilot holes to create tunnels to allow this ACL graft to go into the knee. Dustin, do you mind stepping in and helping me out with this part? All right, so the first thing we do is use a pin here. And through the knee we find the appropriate start point where that ACL should start on that femur. And we drill this pilot hole that will allow the passage of the graft as well as the passage of that small metal button. So that's our pilot hole. We're happy with where everything is there. And then we use a device called a reamer to create a hole that matches the same size that was the graft. We drill this to about a depth of about 20 or 25 millimeters. We'll then use a stitch, and this stitch will aid us in actually passing the graft towards the end of the case. So at this point, we've created a hole on the lateral aspect of the femur that's going to accept the top portion of that graft. We then turn our attention to the tibial side and use these very specialized ACL drill guides to find the point where we would want this ACL to come out within the knee. And creating a pilot hole just like we did on the femur. That we then drill a tunnel. And this is going to be how we pass our new ACL. So we go and we grab this stitch and pull it down through here. And we've got our 2 tunnels ready to accept our new ACL. So we go to the back and we grab that ACL off of where it's been resting and stretching. And these sutures that we passed are going to act to help us deliver this through the knee. So then we come up and through here. So the first step is actually getting this metal button through the knee completely and out this lateral side. It just takes a little. And then when we pull it back upon itself, you'll see that it becomes a rigid fixation point for that graft. So here comes the cool part. So when we pull on these ropes individually, it's going to act to shorten that loop and pull that graft and deliver it and dock it into the femur. So now we've docked it all the way up, and the graft is now entering our femoral side. So now for the tibial side, the metal button only goes on now. We attach it to this tight rope here. And again, you'll see as we pull on the edges of these sutures, this loop here is going to get shorter and shorter and shorter until that button sits flush up against the tibia. We then tension that down on that side, retension it down on the far side. And voila, there you have it. Brand new ACL, ready to hit the pitch again in another 6 to 9 months.